dear friends, welcome to Medical Destiny YouTube channel. In this video, you will go through 25 Nclex-Rn nursing exam multiple choice questions and answers. If you would like to get more videos related to nursing and medical topics, please subscribe my channel.
131. The nurse has completed tracheostomy care for a client whose tracheostomy tube has a non-disposable inner cannula. Immediately before reinserting the inner cannula, which is the best nursing action for the nurse to complete? 1. Rinsing it in sterile water. 2. Suctioning the client's airway. 3. Drying it with loosely woven gauze. 4. Tapping it against a sterile basin and using pipe cleaner to dry it. Answer 4. Rationale. After washing and rinsing the inner cannula, the nurse taps it dry to remove large water droplets and uses pipe cleaner specifically for use with a tracheostomy to dry it. Then the nurse inserts the cannula into the tracheostomy and turns it clockwise to lock it into place. The nurse avoids shaking the inner cannula to prevent contamination. A wet cannula should not be inserted into a tracheostomy because water is a lung irritant. Suctioning is not performed without an inner cannula in place. Fine mesh sterile gauze may be used to dry the inner cannula because it is less likely than loosely woven gauze to deposit debris on the cannula. 132. A nurse suspects that an air embolism has occurred when the client's central venous catheter disconnects from the intravenous IV tubing. The nurse immediately places the client in which position? 1. Trendelenburgs on the left side. 2. Trendelenburgs on the right side. 3. Reverse Trendelenburgs on the left side. 4. Reverse Trendelenburgs on the right side. Answer 1. Rationale. If the client develops an air embolism, the immediate action is to place the client in Trendelenburg's position on the left side. This position raises the client's feet higher than the head and traps any air in the right atrium. If necessary, the air can then be directly removed by intracardiac aspiration. Options 2, 3, and 4 are incorrect positions because reverse Trendelenburgs elevates the head, puts the air in a dependent position, and increases the risk of a cerebral embolism. Lying on the right side places the air in a dependent position, rendering it more likely to migrate. 133. An anxious client enters the emergency department seeking treatment for a laceration of the finger. The client's vital signs are pulse 106 beats per minute, blood pressure, BP, 158/88 of a millimeter of mercury, and respirations 28 breaths per minute. After cleansing the injury and reassuring the client, the nurse rechecks the vital signs and notes a pulse of 82 beats per minute, BP 138 of a millimeter Hg, and respirations 20 breaths per minute. The nurse determines that the change in vital signs is caused by 1. Cooling effects of the cleansing agent. 2. Client's adaptation to the air conditioning. 3. Early clinical indicators of cardiogenic shock. 4. Fall in sympathetic nervous system discharge. Answer 4. Rationale. Physical or emotional stress triggers sympathetic nervous system stimulation. Increased epinephrine and norepinephrine cause tachycardia, high blood pressure, and tachypnea. Stress reduction then returns these parameters to baseline as the sympathetic discharge falls. Options 1 and 3 are unrelated to the changes in vital signs. Because the client's vital signs remain within normal limits, the client exhibits no indication of cardiogen. IC shock. 134. The nurse schedules multiple diagnostic procedures for the client with heart failure who has activity intolerance. The procedures prescribed include an echocardiogram, a chest radiograph, CXR, and a computed axial tomography (CAT) scan. Which is the best schedule for the nurse to plan to meet the needs of this client safely and effectively? 1. CAT scan and CXR in the morning, and echocardiogram on the following morning. 2. CXR and echocardiogram together in the morning, and CAT scan in the afternoon of the same day. 3. Echocardiogram in the morning, and CXR and CAT scans together in the afternoon of the same day. 4. CXR in the morning, echocardiogram in the afternoon, and CAT scan in the morning of the following day. Answer 4. Rationale. CAT scans are always performed in radiology and CXR and echocardiograms can be done at the bedside. However, the best results usually occur when the test is performed in the related department. As long as the client is stable and transportation is provided, the nurse can schedule each procedure in its department with 2 procedures on one day separated by a rest period, and the remaining procedure the next day. The nurse should plan the CXR and echocardiogram on the same day because if the client's condition deteriorates after the first procedure, the nurse can obtain a portable CXR or echocardiogram. 135. The nurse is preparing to initiate an intravenous nitroglycerin drip on a client with acute myocardial infarction. In the absence of an invasive arterial monitoring line, the nurse prepares to have which piece of equipment for use at the bedside? 1 defibrillator, 2 pulse oximeter, 3 central venous pressure CVP tray, 4 non-invasive blood pressure monitor. Answer 4. Rationale, nitroglycerin dilates both arteries and veins, causing peripheral blood pooling, thus reducing preload, afterload, and myocardial workload. This action accounts for the primary side effect of nitroglycerin, which is hypotension. In the absence of an arterial monitoring line, the nurse should have a non-invasive blood pressure monitor for use at the bedside. 136. A client in labor has a concurrent diagnosis of sickle cell anemia. Which action has priority? To assist in preventing a sickling crisis from occurring during labor. 1. Reassuring the client. 2. Administering oxygen. 3. Preventing bearing down. 4. Maintaining strict asepsis. Answer 2. Rationale. During the labor process, the client with sickle cell anemia is at high risk for being unable to meet the oxygen demands of labor. Administering oxygen will prevent sickle cell crisis during labor. Options 1 and 4 are appropriate actions but are unrelated to sickle cell crisis. Option 3 is inappropriate. 138. The nurse assists a client who has a renal disorder collect a 24-hour urine specimen. Which does the nurse implement to ensure proper collection of the 24-hour specimen? 1. Have the client void at the start time and discard the specimen. 2. Strain the specimen before pouring the urine into the container. 3. Save all urine, beginning with the urine voided at the start time. 4. Once completed, refrigerate the urine collection until picked up by the laboratory. Answer 1. Rationale. The nurse asks the client to void at the beginning of the collection period and discards this urine sample because this urine has been stored in the bladder for an undetermined length of time. All urine thereafter is saved in an iced or refrigerated container. The client is asked to void at the finish time, and this sample is the last specimen added to the collection. Straining the urine is contraindicated for timed urine collections. The container is labeled, placed on fresh ice, and sent to the laboratory immediately. 139. A nurse is caring for a client in active labor. Which priority action should the nurse perform to prevent fetal heart rate decelerations? 1. Prepare the client for a cesarean delivery. 2. Monitor the fetal heart rate every 30 minutes. 3. Increase the rate of the oxytocin, pitocin infusion. 4. Encourage upright or side-lying maternal positions. Answer 4. Rationale. Side-lying and upright positions such as walking, standing, and squatting can improve venous return and encourage effective uterine activity. Monitoring the fetal heart rate every 30 minutes will not prevent fetal heart rate decelerations. The nurse should discontinue an oxytocin infusion in the presence of fetal heart rate decelerations, thereby reducing uterine activity and increasing uteroplacental perfusion. There are many nursing actions to prevent fetal heart rate decelerations without necessitating surgical intervention. 140. A client with diabetes mellitus is at 36 weeks gestation. The client has had weekly non-stress tests for the last 3 weeks, and the results have been reactive. This week, the non-stress test was non-reactive after 40 minutes. Based on these results, the nurse should anticipate the client will be prepared for 1. A contraction stress test. 2. Immediate induction of labor. 3. Hospitalization with continuous fetal monitoring. 4. A return appointment in 2 to 7 days to repeat the non-stress test. Answer 1. Rationale. A non-reactive non-stress test needs further assessment. There are not enough data in the question to indicate that the procedures in options 2 and 3 are necessary at this time. To send the client home for 2 to 7 days may place the fetus in jeopardy. A contraction stress test is the next test needed to further assess the fetal status. 141. A nurse is administering magnesium sulfate to a client for severe preeclampsia. During the administration of the medication, the nurse 1. Schedules a daily ultrasound to assess fetal movement. 2. Schedules a non-stress test every 4 hours to assess fetal well-being. 3. Assesses the client's temperature every 2 hours because the client is at high risk for infection. 4. Assesses for signs and symptoms of labor because the client's level of consciousness may be altered. Answer 4. Rationale. Magnesium sulfate is a central nervous system depressant and anticonvulsant. Because of the sedative effect of the magnesium sulfate, the client may not perceive labor. Daily ultrasounds are not necessary. For this client, a non-stress test may be done, but not every 4 hours. This client is not at high risk for infection. 142. A client's nasogastric tube stops draining. Which should the nurse implement first to maintain client safety? 1. Verify the tube placement. 2. Instill 30 to 60 milliliters of fluid. 3. Clamp the tube for 2 hours. 4. Retract the tube by 2 inches. Answer 1. Rationale: if a client's nasogastric tube stops draining, the nurse verifies placement first to ensure that the tube remains in the stomach. After checking placement and verifying a prescription for tube irrigation, the nurse irrigates the tube with 30 to 60 milliliters of the fluid per agency procedure. Clamping the tube increases the risk of aspiration and is contraindicated. Besides, this intervention cannot unclog a tube. Pulling out the tube can displace the tube and place the client at risk for aspiration. Replacement of the tube is the last step if other actions are unsuccessful. 143. A nurse is planning to give a tepid tub bath to a child who has hypothermia. The nurse plans to 1. Obtain isopropyl alcohol to add to the bath water. 2. Allow 5 minutes for the child to soak in the bath water. 3. Have cool water available to add to the warm bath water. 4. Warm the water to the same body temperature as the child's. Answer 3. Rationale: adding cool water to an already warm bath allows the water temperature to slowly drop. The child is able to gradually adjust to the changing water temperature and will not experience chilling. Alcohol is toxic, can cause peripheral vasoconstriction, and is contraindicated for tepid sponge or tub baths. The child should be in a tepid tub bath for 20 to 30 minutes to achieve maximum results. To achieve the best cooling results, the water temperature should be at least 2 degrees lower than the child's body temperature. 144. A nurse is assigned to care for an infant who is 1 day postoperative after a surgical repair of a cleft lip. Which nursing intervention is appropriate when caring for this child's surgical incision? 1. Rinse the incision with sterile water after feeding. 2. Clean the incision only when serous exudate forms. 3. Rub the incision gently with a sterile cotton-tipped swab. 4. Replace the Logan bar carefully after cleaning the incision. Answer 1. Rationale: the incision should be rinsed with sterile water after every feeding. Rubbing alters the integrity of the suture line. Rather, the incision should be patted or dabbed. The purpose of the Logan bar is to maintain the integrity of the suture line. Removing the Logan bar on the first postoperative day would increase tension on the surgical incision. 145. A client is in ventricular tachycardia and the physician prescribes intravenous if lidocaine, xylocaine. The nurse plans to dilute the concentrated solution of lidocaine with 1. Lactated ringers. 2. Normal saline 0.9%. 3. 5% dextrose in water. 4. Normal saline 0.45%. Answer 3. Rationale: lidocaine for IV administration is dispensed in concentrated and dilute formulations. The concentrated formulation must be diluted with 5% dextrose in water. Therefore, options 1, 2, and 4 are incorrect. 146. A client receiving parenteral nutrition, PN, via a central venous catheter, CVC, is scheduled to receive an intravenous IV antibiotic. Which should the nurse implement before administering the antibiotic? 1. Turn off the PN for 30 minutes. 2. Check for compatibility with PN. 3. Ensure a separative access route. 4. Flush the CVC with normal saline. Answer 3. Rationale: the PN line is used only for the administration of the PN solution to prevent crystallization in the CVC tubing and disruption of the PN infusion. Any other IV medication must be administered through a separative access site, including a separate infusion port of the CVC catheter. Therefore, options 1, 2, and 4 are incorrect actions. 147. A nurse is monitoring a postoperative client for behavioral indicators of the effects of pain. Which of the following are indicators that the client is in pain? Select all that apply. 1. Gasping. 2. Lip biting. 3. Muscle tension. 4. Pacing activities. 5. Conversing with the roommate. 6. Enjoying social interaction with visitors. Answer 1, 2, 3, 4. Rationale: the nurse should assess verbalization, vocal response, facial and body movements, and social interaction as indicators of pain. Behavioral indicators of pain include moaning, crying, gasping, and grunting. Vocalizations: grimacing, clenching teeth, wrinkling the forehead, tightly closing or widely opening the eyes or mouth, lip biting, facial expressions. Restlessness, immobilization, muscle tension, increased hand and finger movements, pacing activities, rhythmic or rubbing motions, protective movements of body parts, body movement, avoidance of conversation. Focusing only on activities for pain relief, avoiding social contacts and interactions, and reduced attention span. 148. A nurse is developing a care plan for a client receiving enteral nutrition and identifies the situations that place the client at risk for aspiration. Which of the following place the client at increased risk for aspiration? Select all that apply. 1. Sedation. 2. Coughing. 3. An artificial airway. 4. Head elevated position. 5. Nasotracheal suctioning. 6. Decreased level of consciousness. Answer 1, 2, 3, 5, 6. Rationale. A serious complication associated with enteral feedings is aspiration of formula into the tracheobro. Nclex-Rn. Some common conditions that increase the risk for aspiration include sedation, coughing, an artificial airway, nasotracheal suctioning, decreased level of consciousness, and lying flat. A head elevated position does not increase the risk of aspiration. 149. A client without history of respiratory disease has experienced sudden onset of chest pain and dyspnea and is diagnosed with pulmonary embolus. The nurse immediately implements which expected prescription for this client. 1. Semi-Fowler's position, oxygen and morphine sulfate intravenously, IV. 2. Supine position, oxygen and meperidine hydrochloride. Demerol intramuscularly, IM. 3. High Fowler's position, oxygen and meperidine hydrochloride, Demerol intravenously, IV. 4. High Fowler's position, oxygen and 2 tablets of acetaminophen with codeine, Tylenol number 3. Answer 1. Rationale. Standard therapeutic intervention for the client with pulmonary embolus includes proper positioning, oxygen, and intravenous analgesics. The head of the bed is placed in Semi-Fowler's position. High Fowler's is avoided because extreme hip flexure slows venous return from the legs and increases the risk of new thrombi. The supine position will increase the dyspnea that occurs with pulmonary embolism. The usual analgesic of choice is morphine sulfate administrative. This medication reduces pain, alleviates anxiety, and can diminish congestion of blood in the pulmonary vessels because it causes peripheral venous dilation. 150. A client who recently experienced a myocardial infarction is scheduled to have a percutaneous transluminal coronary angioplasty, PTCA. The nurse plans to teach the client that during this procedure a balloon-tipped catheter will 1. Inflate a mesh-like device that will spring open. 2. Be used to compress the plaque against the coronary blood vessel wall. 3. Cut away the plaque from the coronary vessel wall using a cutting blade. 4. Be positioned in a coronary artery to take pressure measurements in the vessel. Answer 2. Rationale. In PTCA, a balloon-tipped catheter is used to compress the plaque against the coronary blood vessel wall. Option 1 describes placement of a coronary stent, Option 3 describes coronary atherectomy, and Option 4 describes part of the process used in cardiac catheterization. 151. A nurse is caring for a client who has been placed in buccal extension traction. The nurse provides for countertraction to reduce shear and friction by 1. Using a footboard, 2. Providing an overhead trapeze, 3. Slightly elevating the foot of the bed, 4. Slightly elevating the head of the bed. Answer 3. Rationale. The part of the bed under an area in traction is usually elevated to aid in countertraction. For the client in buccal extension traction, which is applied to a leg, the foot of the bed is elevated. Option 3 provides a force that opposes the traction force effectively without harming the client. A footboard, an overhead trapeze, or elevating the head of the bed are not used to provide countertraction. 152. The nurse is preparing to initiate bolus enteral feedings via nasogastric ENG tube to a client. Which of the following actions represents safe practice by the nurse? 1. Checks the volume of the residual after administering the bolus feeding. 2. Aspirates gastric contents prior to initiating the feeding and ensures that pH is greater than 9. 3. Elevates the head of the bed to 25 degrees and maintains for 30 minutes after installation of feeding. 4. Measures the length of the tube from where it protrudes from the nose to the end and compares it to previously documented measurements. Answer 4. Rationale. After initial radiographic confirmation of ENG tube placement, methods used to verify nasogastric tube placement include measuring the length of the tube from the point it protrudes from the nose to the end, injecting 10 to 30 milliliters of air into the tube and auscultating over the left upper quadrant of the abdomen, and aspirating the secretions and checking to see if the pH is less than 3.5. Fowler's position is recommended for bolus feedings, if permitted, and should be maintained for 1 hour after installation. Residual should be assessed before administration of the next feeding. 153. A nurse has inserted a nasogastric ENG tube to the level of the oropharynx and has repositioned the client's head in a flexed forward position. The client has been asked to begin swallowing, and as the nurse starts to slowly advance the ENG tube with each swallow, the client begins to gag. Which nursing action would least likely result in proper tube insertion and promote client relaxation? 1. Pulling the tube back slightly. 2. Instructing the client to breathe slowly. 3. Continuing to advance the tube to the desired distance. 4. Checking the back of the pharynx using a tongue blade and flashlight. Answer 3. Rationale. As the tongue tube is passed through the oropharynx, the gag reflex is stimulated, which may cause gagging. Instead of passing through to the esophagus, the tongue tube may coil around itself in the oropharynx, or it may enter the larynx and obstruct the airway. Because the tube may enter the larynx, advancing the tube may position it in the trachea. The nurse should check the back of the pharynx using a tongue blade and flashlight to check for coiling and then pull the tube back slightly to prevent entrance into the larynx. Slow breathing helps the client relax to reduce the gag response. The tube may be advanced after the client relaxes. 154. A nurse is caring for a client with a terminal condition who is dying. Which respiratory assessment findings would indicate to the nurse that death is imminent? Select all that apply. 1. Dyspnea. 2. Cyanosis. 3. Kussmaul's respiration. 4. Tachypnea without apnea. 5. Irregular respiratory pattern. 6. Adventitious bubbling lung sounds. Answer 1, 2, 5, 6. Rationale. Respiratory assessment findings that indicate death is imminent include altered patterns of R. Aspiration, such as slow, labored, irregular, or Cheney-Stokes pattern, alternating periods of apnea and deep, rapid breathing, increased respiratory secretions and adventitious bubbling lung sounds, death rattle. Irritation of the tracheobronchial airway as evidenced by hiccups, chest pain, fatigue, or exhaustion, and poor gas exchange as evidenced by hypoxia, dyspnea, or cyanosis. Kussmaul's respirations are abnormally deep, very rapid sighing respirations characteristic of diabetic ketoacidosis. 155. A nurse is caring for an infant with spina bifida cystica, meningomyelocele type, who had the sac surgically removed. The nurse plans which of the following in the postoperative period to maintain the infant's safety. 1. Covering the back dressing with a binder. 2. Placing the infant in a head-down position. 3. Strapping the infant in a baby seat sitting up. 4. Elevating the head with the infant in the prone position. Answer 4. Rationale. Spina bifida is a central nervous system defect that results from failure of the neural tube to close during embryonic development. Elevating the head will decrease the chance of cerebrospinal fluid collecting in the cranial cavity. The infant must be positioned prone to decrease the pressure on the surgical site on the back. Binders and a baby seat should not be used because of the pressure they would exert on the surgical site.
If you have any queries, please comment below, hit the like button and share video with your friends. Thanks for watching. Thanks for your precious time.